and I think that's
even in this community, there are large hospitals that have systems that cannot communicate,
Right.
cannot exchange information in any way, and it also goes that way with many of those group practices who have chosen to go to electronic means.
right.
They can't communicate. I mean, their system can't communicate outside of their clinic.
Exactly.
And that is very costly because you're making a custom system for each office.
But-
You're doing the same work 2-3 times over.
Yes. We pay 25% of our, in that one of the charts is there, 25% is bureaucratic paper shuffling.
Right.
Well, William McGuire's salary is there too, but the HMOs and the bureaucrats take up, which is number one, I think, in the world. Nobody spends so much on bureaucracy. Maybe Luxembourg or some other. There's one more country maybe.
That's a great point.
All right. Is that it?
Yeah, that's it.
That does address points made in both 2004 healthcare platform and Obama's that we have to increase the efficiency of the system, and particularly information exchange.
Would there not also then be a need for some oversight of a standard system, both in terms of cost and looking for quality of care? Every doctor thinks their office is, the ultimate in quality, and yet, if you were to compare 10 offices, even if they're all in the same subspecialty, you're going to see a variety of how various things are handled. I don't want to do cookbook medicine, but at the same time, the hospitals and many of the health systems have noticed that certain techniques provide much better results than others. And if we could somehow educate our physicians as to what are the better ways of taking care of item A.
Sort of like if it's the best practice guideline.
Yes.
That's what
Yes.
what does Keith's call it, we're talking about.
Now, whether you base that on financial or whether you base it on best outcome for the patient, I mean, there's a number of things that have to be thought of. But I think if we could get the best outcome at the lowest cost,
And that seems to be part of David Reamer's discussion. Stan? Oh, were you finished, Tom?
oh,
Did you have something else?
I could go on for hours.
All right, well, in the discussion, everybody write things down in the discussion as well.
Well, prevention has been mentioned, but in connection with that, I feel that childhood obesity is a national tragedy, and that we must address that.
That too is education. If you tell the average parent how much sugar is in a can of Coca-Cola, they look in the eye and say, come on, it can't be that much.
But it's been written on the can for 15 years.
It's more than
I
education.
think it's more than education.
Do you think it's Coca-Cola that's tripping them up or apple juice?
I mean, I think that's where one of the bigger problems
Well,
is.
apple juice causes more rotten
That's
teeth
it.
In children
Yeah.
than Coca-Cola does.
I
because-
think, I think that, yeah, I think there's a whole kind of change that has to go on at how parents look at what they give, and I have 2 young kids, so I do this
Chris,
constantly.
we also have to remind ourselves that at times milk causes problems too.
Right.
You see rotten teeth from kids who suck on a bottle all night long and keep the teeth bathed in milk, and the enamel gets eroded, and we have children. I see that in Central America. Oh, it's awful. It's almost universal. And the older kids, part of their nutrition includes chewing on pieces of sugar cane, because it grows there like weeds.
Well, this brings up one of the contributing factors, which is that the official agencies, the governmental agencies that all work in silos, like, for example, the agricultural, the people that take care of roads and departments of transportation, and public health is interested in prevention of injuries. And, public health is often left out of the discussion about where stop signs should be and where roads should be. And we see that so much in just the bioterrorism prevention groups that are meeting, and how fire and police are certainly first responders, but sometimes public health should be included in the dialogues for plans. It's better than it was, but it still is backburned.
I have a bit of a list. I'm going to kind of focus it on things I think should be in policy platform. First of all, I'm going to start by endorsing David's statement. Everyone should have insurance. There shouldn't be some people who are outside the system, neither contributing nor benefiting. I think everyone should actually be, that there should be a similar standard for the content of that mandatory insurance that David has mentioned, such that people can begin to compare who is providing the best value for that product. So that I'm willing to allow people to move their insurance plan to the system of care that provides the highest quality and the lowest cost, rather than a single provider system. I'd be willing to entertain a single provider system, but
Oh, no, I
don't think
said
we're gonna get
single
there.
payer.
Yeah.
It is the funding, not the provider. It's the funding, where the funding comes from.
So I think that's fundamental. It's not in the 04 platform. Of course, it's not in Obama's platform yet.
So, identify those providing the best care for the lowest cost, and you said that's a system-based
Well,
position?
yeah, we talked before about how the incentives for healthcare providers are anything but rational. So ideally, you have systems of healthcare providers who are competing for patients to join their systems, and that are also reporting both costs and quality transparently.
I think that endorses Obama's plan for the National Health Insurance Exchange.
Yeah, the exchange is hazy in my mind, but he's moving in that direction. But again, everyone needs to have one of these products, and I don't like the idea of having many different tiers of products. I think they should all look, people can buy more and more and more, but everybody should have a minimum. And I think so. Everyone has a health insurance, of a similar standard. If they buy more, that's up to them. So I think that's fundamental for good policy. I mean, I think we've talked about a lot of other things. I think we greatly need to increase the investment in public health infrastructure. The public health departments are not competitive.